Andy, this is Dr. P. Ravi Kiran, General Physician and Diabetologist at ONUS Robotic Hospitals, Champapet. As a part of corporate social responsibility, we have been taking awareness sessions about the metabolic disorders like BP, sugar, cholesterol, and thyroid. Today, let's discuss about the basics of blood pressure. What is blood pressure? What are systolic and diastolic blood pressures, and what can we do about those things? What is blood pressure? Blood pressure is the force which blood pushes against the walls of our artery as the heart pumps blood to the entire body. See, whenever there's a heartbeat occurring, there would be a lump end where the heart contracts and the heart relaxes. Whenever the heart contracts and relaxes, there will be a certain pressures. Those are created by pressure by the heart onto the body. The one when the heart pushes the blood is called the systolic, whereas the pressure maintained by the blood vessels when the heart relaxes is called as diastolic. These two are the pressures. Think of it like water flowing through a pipe. More force, more pressure. The more the quantity of the water that's going through, the higher the pressure would be. Why are there two numbers? When we measure BP or whenever we note down the BP, we get two numbers which is written like this 120 by 80. Each number tells us something different about our heart. So the two numbers are equally important. Both systolic and diastolic, both are equally important. Systolic blood pressure, the upper number. The upper number is also called as systolic blood pressure. The pressure in the arteries when the heart contracts. When the heart contracts, that's the pressure. The pressure generated by the heart is called as systolic blood pressure. Blood is pushed forcefully into the arteries. Example 120, which is the normal value. Why is it important? Indicates how hard the heart is working. High systolic blood pressure risk increases the risk of heart attack, stroke, heart failure, and it's common in elderly due to stiff arteries. What happens in elderly people is the blood vessels should relax whenever the heart pumps blood to it. But when the blood vessels are not able to relax properly and the heart starts pumping with forceful pressure, the systolic pressure rises drastically and that leads to high systolic blood pressure. And it's commonly in elderly and it increases the risk of heart attack, strokes, and heart failure. Whereas diastolic blood pressure, which is the lower number, what it means, it is the pressure in the arteries when the heart relaxes between the contractions. The heart is resting and filling with blood, and this is the time this tone or this blood pressure is maintained by the elastic recoil of the major blood vessels. So for example, the normal value is 80 millimeter of mercury, and why is it important? It reflects the resistance in blood vessels. See, whenever the heart is relaxing, the blood vessels contract and provide some resistance and maintain the blood pressure to 80 mm of exit. But when the resistance increases, the diastolic blood pressure increases. High diastolic blood pressure damages kidneys, brain, and eye. And it's common in younger adults with stress, obesity, or insulin resistance. So the resistance in the blood vessels leads to diastolic high blood pressure. So we can correct it by doing lifestyle changes. How to understand BP recordings? Always remember the normal values are 120 by 80, which includes normal. Borderline or prehypertensive can be 130 by 89, which is the latest recordings, but there will be ever changing trends in the hypertension management schedules. 140 by 90, more than 140 by 90 indicates high blood pressure, whereas the systolic blood pressure of more than 160 and diastolic more than 100 indicates dangerous levels of blood pressure, where there can be an end organ damage or it can prove life threatening or fatal. Important clinical tool. Many people ask, Doctor, only my upper number is high. Is it serious? Yes. Always remember, if it is only upper blood pressure is high, there will be a certain risk factors which we inherit. If the diastolic blood pressure is high, then we also inherit some other different types of high risk factors. So always don't ignore your diastolic blood pressure thinking it would be normal. High systolic alone, stroke risk increases. High diastolic alone, kidney and heart damage occurs. If both are high, the maximum risk occurs. Why BP rises over time? Always remember high sugars, high blood pressure, high cholesterol, and obesity. All four occur from metabolic syndrome, which occurs secondary to insulin resistance. So whenever there is insulin resistance, all of these problems occur. Weight gain, especially belly fat or visceral fat, which produces many chemicals causing insulin resistance, is one of the major cause for high blood pressure. Stress and poor sleep, excess salt, diabetes and insulin resistance, lack of exercise, genetic risk. Even genetics also play in a role in your hypertension. But always remember, the genetic factors can, in majority of the times, be overcome by the diet and lifestyle changes, and the genetic risk can be mitigated or reduced. BP doesn't rise suddenly, it rises silently over the years. That's why high blood pressure is also called as silent killer, where the people don't have any symptoms until they develop a severe or ischemic stroke. Systolic blood pressure shows how hard your heart works. Diastolic shows how relaxed your blood vessels are. Both these numbers matter. The main issue of the patients would be these systolic and diastolic blood pressures rise slowly over a duration of time without much complications. But what happens is, as the pressures keep on rising, initially the body tries to accommodate the changing blood pressures. Like the kidneys would try to overcome the pressure by reducing the arterial length. Heart would increase in size to pump again more pressure. Brain blood vessels would come down. So like this, multiple changes happen to the body over a gradual course of time. Therefore, many a times there won't be any major symptoms. But after a certain point of time where the body compensation starts coming down, then there would be a sudden onset for heart failure or a brain stroke, which would prove fatal. So always remember, majority of the times hypertensive patients don't have any symptoms, and the only way to identify hypertension is go for a regular screening, where you can have a home BP apparatus or go to a nearest clinic and get your BP checked. If it is persistently more than 130 by 90 or 140 by 90, it's high time you visit a doctor, take necessary diet and lifestyle changes, go behind hypertension reversal, and if it's needed, use medications. Do follow all these necessary things and protect yourselves. This is Dr. P. Ravi Kiran, general physician, diabetologist, and preventive medicine specialist from ONUS Robotics Hospitals, where we can guide you for hypertension reversal and hypertension control with the least amount of medication.